So items needed for nasal gastric intubation is red rubber catheter, which is a 5 fringe. Then you have your 3/0 Wem-Max suture material, 2 3cc syringes for your sterile water. Then you have your 1cc syringe for your lidocaine for better intubation and less irritating for the patient. Lubricant, so it's smoother going into the nasal cavity. And then you have your e-collar so the patient does not mess with the incision area. So beginning with the nasogastric, measuring from about mid area of the abdominal area all the way to the nasal passage. So I would mark right here with a piece of tape. Right about here is to where the nasogastric tube would go in. Patient's head will be slightly tilted. The feeding will go in at medial ventral, and it would slide in, and it's placed. Prior to doing that, lubricant will be added, lidocaine gel. So as demonstration, you have your lubricant, and if I was actually doing this, I would be drawing up lidocaine gel. We'd be applying 2 to 3 drops per nostril. Lift patient's head up, apply drops. Let that sit for a second. Apply lubricant. Feed into the patient's nasal cavity, where it goes down into the stomach. And then from this point, it can get sutured to the patient's face, and an e-collar can be placed right over the head of the patient.